Welcome to Module 3, The Case for Support. Nonprofit organizations put together cases of support to explain their cause and why donors should continue to support them financially. Each year, our case for support evolves to ensure that we can meet the changing needs within our community. This year's theme, Emerging Stronger, follows last year's theme of healing our community in 2021. As you can see, our case statement this year is, the Harrison Family YMCA has always been a safe place for youth, families, and individuals to grow. As our community rebuilds from the pandemic, our Y is emerging stronger to continue to provide a safe and supportive environment for all. It's important to note that 100% of the funds raised will be used to meet the needs of our community and ensure the Y is strong for the long-term future. This will include typical annual campaign program support, such as we learned about in Module 2, as well as the greatest needs of our Y organization, which might continue to include general operating support during this time.
Our case for support focus areas this year are supporting our youth, advancing health equity, and ensuring access for all. As we go through these focus areas, please think back to what we were talking about in Module 2, why we raised funds. If you think back to those photos and those stories, it'll really help these focus areas come to life, which in turn makes that storytelling come to life as well. So in supporting our youth, if you think back to that summer camp photo of those kids running in that field, having a great time, it's a perfect example of our out-of-school care programs here at the Y. We offer before and after school care at a number of schools in the Nash County school system. We also offer holiday and summer camp here on site in the Y building, as well as after school care here in the Y building. And they're so important. They help working parents stay on the job. They're able to bring their kids here, know they're going to get healthy meals, great care from our staff, including social emotional learning, homework support, character development. Our team does a great job here and keeping the kids busy, active, and eating good healthy foods. If you think to the photo of the swim team, we've got other youth and family programming. We also have, as you'll see, aquatic and gymnastics programming. I'll kind of talk about them all together. Whether it's a TOTS sports program or Teens in Training upstairs, where kids age 10 to 14 can come in and work with one of our personal trainers so that they can become certified to use the cardio equipment and equipment on the balcony, so they can begin practicing healthy habits that hopefully will last a lifetime. Got a lot of neat programs for youth and families, you know, the Easter events, the fall family events, lots going on. In the aquatics programming, we've got programming that starts, you know, kids can start taking swim lessons at 6 months. They can progress from swim lessons into swim team and eventually roll from swim team into our lifeguarding class. It's a great way that we support children in water safety and programming from childhood all the way into adulthood. The next focus area, advancing health equity, and by that we just mean helping people have the information and resources that they need to lead the healthiest life possible. And so we're committed to helping advance health equity for all in our community. For us, that takes the form of food distribution to families and seniors in need. As we talked about in Module 2, it had been part of our strategic planning. We had identified that food was an issue in our community, and when the pandemic hit and we learned about families and seniors who were food insecure and facing hunger, we hopped right in and developed a program where we were able to deliver food to folks who were unable to access the food themselves. And a lot of the times, we have a number of seniors who no longer drive. There may be, we have some seniors who walk to the dollar store in their neighborhood to buy groceries, but we're able to step in and help them supplement their pantries with what we bring. We also work with the food pantry that provides meat and eggs and all kinds of other food for these families. And we also had families, we had one who they had a car, but they often didn't have gas money, so they couldn't get to the store because they just didn't have money for gas. They were often asking for gas cards when we dropped off food just to live their life. So the food distribution's one program that the annual campaign, we just couldn't run the food program without annual campaign funds. We also work as a summer feeding site for kids. They can get healthy meals here. A lot of kids depend on school meals, and when school's out, it can be a hungry time. So we make sure that we offer food to kids in our programs here. And then we also use annual campaign funds for community and nutrition outreach. So the walk audits and the walking club programs that we do help combat chronic disease, help people lead more active lives as well as more socially engaged. It's been a really tough time. The social isolation, the pandemic, people have gotten out of touch. And it's a nice time to be able to reconnect. So you're strengthening folks in more than just body, but also spirit and mind by offering those kinds of programs. And of course, the expanded food nutrition education program has been a great way for families to gather together, the cooking demonstration, try recipes, experiment. It's a really empowering program, helping folks figure out how to cook with what's in the cupboard, how to cook healthy meals out of what's in the cupboard, and then how to use some of these produce boxes that were widely available and introducing them to new produce. We have a really neat story Natima has of running into a family that graduated from the program, and the kids were in the fruit and vegetable section picking out their favorite fruits and vegetables, and the mother attributed that to participating in the class. So then our last focus area is ensuring access for all. We've talked about the financial assistance program and how it knocks down that financial barrier obstacle that so many folks face. They want to be able to put their child in swim lessons or our after-school care program, but it just doesn't fit in their family budget at this time. Financial assistance makes it possible for that to happen for them. We also have some chronic disease prevention initiatives. We've been able to launch blood pressure self-monitoring, and we're looking forward to finding ways to take that out into the community over the next couple of years. We have we're thrilled with Biden EdgeCom grant funding. We've been able to take enhanced fitness. It's a 16-week evidence-based group exercise class designed for folks with arthritis. It also helps with falls prevention. We've been able to take that to the senior center in Tarboro. So expanding, going outside the walls of our facility and taking some of our excellent evidence-based programming out into the community to folks who might not otherwise be able to access it, as well as the walking clubs that I've touched upon. So these are our areas of focus for annual campaign support this year. These funds, the annual campaign funds, make this all possible, and the work that you're doing to raise these funds are what drive our why, what drive this program. We couldn't do these things without these funds. It's essential to have them, otherwise the program just doesn't happen. We're so appreciative of you stepping up and agreeing to volunteer in the campaign and reaching out to these donors who make it all happen.